Welcome to this LEX 18 digital conversation. I'm Dia Davidson. You know, there are 5 medical complications that commonly cause maternal death and injury. African American women are 2 to 3 times more likely to die from these issues than white females suffering the same complications. So what's the cause and what can be done to raise awareness and reduce the maternal and infant mortality rates? Joining me now are Dr. Quinetta Johnson from UK Hospital and Dr. John Barton from Baptist Health. Welcome, both of you.
Thank you.
So what's happening? It's one of those things where sometimes, especially as an African American female, we know another African American mother who has succumbed. So what seems to be happening? And these are not women who are not educated or not having health care, but it seems like something happens at what should be the most happy and joyous time.
So you're right, it's not uneducated women. There have been studies that show that African American college educated women have higher rates of complications compared to Caucasian women that are not college educated, and so clearly there is something going on. I think there's a combination of issues from the fact that African American women initiate prenatal care a lot further along in the pregnancy than white women, and there are reasons behind that as well. And then there's that piece of, I don't feel like when I'm communicating that this or something is bothering me that I'm being taken seriously or that I'm being heard. I think there's the combination from the patient and the family standpoint as far as communication, and then there's a issue with the healthcare system and from the checking in through up to the doctors. So I think that there's a combination of issues when you start to look at the complications that affect African American women.
So Dr. Barton, how do we fix it?
Well, we clearly know that African American women have a higher baseline rate of chronic medical issues. Hypertension, diabetes, and I think the ones that are directly pregnancy related would be preeclampsia. And classically, preeclampsia is cured with delivery. But just because you are delivered doesn't mean you're immediately cured. And this is one of the things we're seeing, late postpartum preeclampsia, late postpartum eclampsia, where it's happening more than 48 hours from the delivery. So when these patients make complaints either to the physicians or to emergency room physicians, they tend to assume, well, you're delivered, so therefore you're cured, but indeed you're not.
So let's define preeclampsia and eclampsia so that people understand, and what are some of the symptoms or feelings that a mother may have or her loved ones may notice in her so that they can kind of say, this is not right, we see this is not right.
So preeclampsia is gestational hypertension. It's blood pressure elevation secondary to the pregnancy that is cured by 6 weeks following delivery, and the hypertension resolves. And something else, and that something else is usually spilling protein in the urine, but it could be symptoms of headache, epigastric pain, and laboratory abnormalities such as a low platelet count or elevated liver enzymes. And patients often will complain with these, but again, since we assume they're delivered and it should have resolved, then they're often not given the attention that they deserve.
So what is there a test that maybe mothers should request or ask their physicians or their OBGYNs to say, hey, can you do this for me just to check me, just to know that I'm okay?
So one of the issues is women may not even have any symptoms. Those symptoms that Dr. Barton just spoke of are the characteristic symptoms, but some women don't have the symptoms, and they come in for their postpartum visit and they have elevated blood pressures, and that's how we go down the line of looking for preeclampsia. There's not really a test to look for it up front because when they are discharged from the hospital, if they've not had any blood pressure issues, then there's no reason for the medical community to feel that they're going to develop them. And so there's no reason to bring every single woman back for a blood pressure check before their postpartum visit.
But is it something that if I'm African American, I'm saying, well, I'm going in to have this baby and I don't want to die, can I say, doctor, can you please do this for me, whether I'm symptomatic or not?
Well, part of routine care, if you're coming in for a delivery, is we're going to monitor your blood pressure very closely, not only in labor, but immediately postpartum. And if there's any hint that the blood pressure is up, then we would have that patient back sooner. And then most routine postpartum instructions now include, if you have symptoms of headache or dizziness or epigastric pain, that you need to be seen sooner back. Or if we know that you have preeclampsia, we would want you to come back within 72 hours, well, 72 hours or 1 week, just to check to see is your blood pressure coming down as it should.
But it seems like in a lot of these reports, at least the ones that I've found, is that this is happening in the hospital, but yet there's nothing that's being done, or this is happening after the woman once gets home, and at that point she's at home by herself and this happens. So is there something that maybe a mother who is hearing these reports and saying, I'm about to deliver, I'm scared to death, I don't want this to happen to me, I don't want to become a statistic, is there some kind of preventative, something that she can maybe do or ask for, or just kind of be on the trigger for?
The biggest problem with preeclampsia, and it's different from many other medical issues, if I'm worried that you have diabetes, I can check your glucose and I can make that diagnosis. If I'm worried that you've had a heart attack, I can check a troponin level and I can make that diagnosis. Right. There is no test that's specific for preeclampsia. It's mostly blood pressure and symptomatology.
Okay. So now let's move from the mother to the infant. Mm-hmm. In some of these cases, within hours of delivery, the children are dying. What's causing that? What seems to be the issue?
We have to recognize that African American women have a higher rate of preterm delivery. And so preterm babies have a higher incidence of passing away from the complications, and there are a host of them, from just being born preterm. So when you compare the infant mortality, that's going to play a role in the increased number of African American women, African American babies who are passing away. And so in order to take a hold of that, then we have to try to find a way to prevent the preterm delivery rate in African American women.
Is there, besides bed rest, is there medicine or some type of intervention that can happen?
There's not any necessary medication, especially for a first pregnancy, because when your very first pregnancy, you have no history of delivering early. So there's no way that we would be able to tell that that's going to occur in this pregnancy.
Not even looking at like your mother or your mother's mother?
Just your sister could have a preterm delivery, and you have 5 full-term vaginal deliveries without any complications. Right. And so that first pregnancy is very hard to tell if you're going to be at risk, and that's regardless of race. And so once you've had the initial preterm birth, depending on the reasoning behind it, then there may be interventions that can be put in place to prevent further preterm delivery. And you have to go back again to what's causing the increased rate of preterm delivery in African American women in the first place.
And that typically is the mother's health.
Well, you have to look at, and for me, you have to look at these complications as a whole as to why they're occurring so high in African American women. And to be honest, there have been enough studies to show that just stress in pregnancy, stress of being a black woman in the United States contributes. The stress of discrimination and racism contributes. The stress of being born into poverty and then areas of low resources contribute. So the not knowing that you need to go get your first prenatal visit as soon as possible contributes. So all of these things contribute to delaying prenatal care, as well as the complications that come along with it.
So the best time to, I guess, seek out and get a physician and get or a midwife or some medical person is the moment you've I guess, get that stick in?
I disagree.
Or should it happen?
It should happen before
prior?
you get pregnant.
Okay.
So the preconceptual counseling to optimize your medical problems. If you have diabetes, to optimize that. If you have hypertension, to treat that properly. To get on prenatal vitamins. So all of this before the pregnancy is so important. Now, once you are pregnant, in the United States right now, 23% of pregnant women, this is the most recent data, do not receive their first prenatal visit until after the first trimester.
Wow.
That's unheard of in developed countries through Europe, Canada.
So why? When we have...
Some of it's insurance.
And African American women have the higher rate of being uninsured until they get pregnant, and then Medicaid kicks in, and
right.
then now they have the medical insurance. And Dr. Barton is absolutely right. If you have diabetes and you come in the second trimester and you've not had any care previous and your diabetes are out of control,
right.
then more than likely you're going to have a complication.
And then I guess weight would be another something too.
Well, that goes back to, in the United States, overall, probably 1/4 of pregnant women are obese. Right. And that percentage is slightly higher in African American women. So with obesity goes higher risk for diabetes, higher risk for preterm labor, higher risk for cesarean delivery. Right. And that's the benefit if you do preconceptual counseling, not that you're going to make people lose huge amounts of weight, but trying to get closer to an ideal weight.
Exactly. And the difference between vaginal and C-section, are we seeing more African-American women moving towards C-section? And is it because of any particular reason?
Well, they definitely have a higher C-section rate, but again, they have higher comorbidities, including the diabetes, high blood pressure, obesity. So those are risk factors for having a cesarean section, so you would expect their rate to be higher. So I feel like the only way to back up and decrease these complications is we have to first understand and manage what is causing African American women to have these risk factors in the first place.
And C-section is a major surgery. It's not just a walk in the park, is it?
Well, and not just for that pregnancy. There's clearly data now that once you've had a C-section, it increases your morbidity in subsequent pregnancies and may actually reduce your fertility.
Oh, wow. And then let's talk about being fibrocystic, too. African American women typically are more inclined to be fibrocystic. Is that true? And have fibroid tumors and things of that nature that also may play a part in this?
It's been some studies. I don't know the exact numbers on fibroids, but there have been some studies to show that African American women have a higher rate of fibroids. But as far as that particular diagnosis causing issues in the pregnancy, I don't know the data for.
The problem with uterine fibroids is that you're more prone to a malpresentation, that the baby may not be head first. And if the baby is breached, then in the United States, you're going to get a delivery by cesarean section.
Gotcha.
But going back to your point about the infants, again, more prenatal care is going to help us with that. We've got better ultrasound to pick up some fetal anomaly that may not be known if you've not had established early prenatal care. Checking for group B streptococcus to make sure that that's known and treated at the time of delivery. You know, getting good prenatal care clearly can improve maternal and newborn outcome.
And getting it started before you
early.
ever start thinking about wanting to be a mother. That's the best thing you can do for yourself and for your baby.
Absolutely. But then you have to have the insurance to get the prenatal care or the preconceptional care.
Indeed. Doctors, thank you so very, very much. And thank you so much for watching this LEX 18 Digital Conversation. Be sure to watch more conversations on lex18.com. Until next time, I'm Dia Davidson.